Alright, this video is for the guys, the gentleman, the macho man. Here's the thing, there's an interesting, really cool procedure that I've kind of been working on and developed, and I'm loving the results. I named it the Adonis procedure. Why is that? Because I'm taking your body and I'm reconstructing it by removing fat from areas that you really don't like and you can't get rid of no matter how much you work out. And you could be in good shape, but you just can't get that last layer of fat. So I get rid of it, I sculpt your body, and then I take that fat and I can inject it in different muscle groups to rebuild your body. So I inject it into the pectoral muscles. I can inject it into your rectus muscle. I can inject it into your shoulders, your biceps, your triceps, your trapezius. I can go to the buttock area and inject it. I can inject it in the calf. Now, if you got that much fat to do all those muscle groups, then we gotta talk. But the thing is that typically I'm limited to the upper body and I'm usually reconstructing the upper torso. So the procedure is kind of liposculpting with fat reshifting to all those different areas, and the results are spectacular. I mean, I am loving it. So what it involves is doing liposuction, but you end up taking fat away where the muscle groups meet, so those are creating the little valleys. And then I gotta create the hills. That's where I have a little bit of fat that's left on top of the muscle group, not that much, a little bit, and then I inject fat into the muscle and that pops it up more. I got my little valley where I did the liposuction, so now I've created shadows. It's an extremely natural appearing technique. The issues with liposuction, like you may have read about, is that it can cause discoloration, it can cause lumpy bumpiness, it can cause irregularities. It could also create a lot of fibrosis where you got to do a lot of massages afterwards. So when I do this procedure, particularly for guys, I do recommend that you get massages, and typically it's around 10 massages. It could be 15 of them, and some people a little bit more. Sometimes you don't need as many, but I'm thinking that you're going to need about 8 to 12 to 15 massages afterwards just to help with everything. Getting back to work will be about 7 to 10 days. Feeling normal is a month. Final results is 3 to 6 months. So in the beginning you may look good depending on how much you swell, but then you swell up after that and then you kind of lose the definition. And then at about 6 weeks to 8 weeks, everything starts to shrink in, and in about 3 months you're looking, whoa, that's really good. The issue is that not all the fat's going to stay in the muscle where I inject it. Typically I get about a 60% survival, and some people 40, some a little bit more, but it's around there. That's going to depend on your overall results. So I'll pump up the muscle as much as I can, and then I got to give it 6 months to see how much of it stayed. Surgery takes me about 2 hours, 2 hours and a half. Now guys, you tend to be really wimpy, more so than women. There's a new medicine that you guys are gonna love. It's called Exparel. Exparel is a medicine that I inject during the liposuction into the tissues, and I can only during that time. I can't do it at any other time, but only when I'm doing the surgery. And it decreases the pain by almost 80% for the entire process. 80%, if not more. It's amazing stuff. Guys are loving it because we tend to cry for the first 5 days. So this is really making a dramatic difference. When I do the Adonis procedure, I do leave drains in because the body produces fluid. Those drains stay in for 5 to 7 days. I do put you in a garment that I want you to wear for about a month. I don't want you working out for about a month because I want to try to preserve the fat, but I do want you stretching. You've got to stretch. Pilates or yoga are amazing stuff, but wait about 2 to 3 weeks to do that, but I want you stretching right away. Important thing, guys, you all need to know about is that the testicles can swell, the pee-pee can get black and blue. Don't freak out, it's not going to fall off. This is temporary. It'll go away and it'll get better, but don't freak out. So that procedure is something that guys are starting to love. So what you would need to do now is make sure you keep in contact with your coordinator. They can answer all the questions as to where do I stay, how much is it, what labs do I need, what's the next process. They'll go through all of that kind of stuff and they'll give you the price quote. And then I would love to see you guys here in the office during your pre-op consultation where we'll go over your goals and your specific needs. There is 2 things that I wanted to talk to you about. One of them I already did, that's the Exparel, but the other thing, it's called J-plasma. J-plasma is a procedure that's like a laser that I run during surgery, and it gets that skin to retract down and it tightens it up. It gives me a better result, so that's called J-plasma. So the 2 things on top of the Adonis procedure are the Exparel for pain and the J-plasma for skin tightening. One other thing, when I'm dealing with guys, what we're always talking about is the little boobies, the little gynecomastia that some guys have. That gynecomastia can sometimes be improved through liposuction and shifting of fat. So I inject the fat more in the top, not the bottom, because you don't want to get a Victoria's Secret bra as part of the procedure. I mean, I'm trying to give you a more masculine chest. And down here, what I do is that I liposuction. I traditionally run that J-plasma, which is that skin tightening device. Occasionally, I got to make a little incision to take out the glands that you've got there. So the chest area, and guys, is probably the most difficult part to contour, but we're having a beautiful result. Expectations are, if you use the Exparel, pain is way decreased. If you don't use it, expect some discomfort for sure. Expect some tightness. That goes away after about 6 to 8 weeks. And then, like I said, the surgery takes about 2.5 hours around there, 2 to 2.5 hours. So I look forward to seeing you guys. Hang loose.